Hello, my name is Jill Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. And today, I couldn't be more excited to welcome Kathryn Kuba-Dandurand, who has graced NMC with her inspiring harp music for 13 years now. So we're going to talk about the healing art of music. But first and foremost, I want to welcome you to this show.
Thank you. It's a pleasure to be here. And we're going to start by letting the music speak for itself.
Beautiful. Oh, if we could all start our day like this. That's fantastic. Thank you so much for being here.
It's a pleasure.
And the music does speak beautifully for itself. But let's hear a little bit about you. Who is Kathryn?
Well, I've been playing the harp for over 30 years.
Amazing.
It's amazing. I'm starting my 13th year at NMC as a therapeutic musician. I also play at Franklin County Rehab, many of the nursing homes throughout Franklin County. I never thought I'd be doing this. I started out piano 10 years as a child, and the harp is actually a sideways piano. These are the white keys of the piano, and these are the black keys of the piano, where I get a sharp or a flat.
Ah.
So it was very easy for me to start playing. I went to a concert, and I heard a live harp, and I went home. I loved the sound. I said, I have to learn how to play that. The next week, I bought my first harp. I had a harp teacher. So I feel like this career is a culmination of all my skills in my lifetime. It's kind of a dream. It's a dream career. I have my master's in early childhood special education. I did a lot of home visits, ran preschools. I'm a licensed massage therapist. I used to play live harp
knew all
music
this about you?
at the head of the massage table 15 minutes before and after the massage, and I became so interested in why I had to play different music for different people and before and after. Meanwhile, many other people were starting to think about the healing power of music and the harp. So I became trained by the International Harp Therapy Program, and I was certified in 1996.
Wow, it's amazing. And so maybe tell us a little bit about the therapeutic value of music.
Yes. Well, let me start by saying I'm not a performer. I'm not an entertainer. We're trying to create a cradle of sound to support people physically, emotionally, and spiritually. So the International Harp Therapy Program, there's 7 or 8 other programs out there as well. Some of them may use other instruments, guitar, voice, flute, anything that can be comforting and peaceful to people. We are all approved by the National Standards Board for Therapeutic Musicians. We have to earn CEUs every year to continue our certification. The curriculum is very intensive. There's a whole music development, which I'll talk about a little bit later, and then we have an incredible module on inclusive attention. We learn observational skills. We're looking at your breathing. We're looking at your eye movements. We're looking at body movements, the atmosphere of the room. So we have all our tentacles out when we go into a room. We learn all about medical terms, how different medications affect patients, the anesthesia. We learn what works for Alzheimer's, different delirium. Very interesting curriculum. You can go online to the International Harp Therapy Program and read all about what we learn. You can look at practitioners all over the country. It is worldwide now. Japan, Australia, England, France, they're all training harpists, musicians to work by the bedside.
Wow.
Music is powerful. So why the harp? Historically, it's been an instrument of healing and comfort. You look at old paintings, the harp was always by the bedside of somebody who was ill or dying. We can go back to the Bible, David soothing King Saul, the Greek and Roman lyres, the little U-shaped. It's a beautiful thing to look at.
It is.
People always say, oh, I love the harp. It's the sound. Because it's a plucked string, there's no fret, hammer, mallet hitting anything. It's a very pure tone. And there's all these harmonics and overtones in it that we are hearing, even though we don't realize it. So it's this whole tone that everybody just really loves.
So I was struck by your eye contact with me.
Yes.
That's something I noticed. I mean, you were playing and then you were checking in with me. And so tell me about a typical day at the hospital, because I not only felt the music, I felt you.
Yes. And I never know what I'm going to play before I go in a patient's room. If I do, I'm not doing my job. So all my tentacles are out as I go in there. We use two basic principles, which is resonance, which is that it's the frequency at which something is vibrating, and we use entrainment, which is actually a physics principle. And I can best explain it by two grandfather clocks in a room, and their pendulums are swinging at different rates. If you leave them in that room long enough, they will end up swinging at the same rate. So when we go in that room, we are finding that person's resonance, and we are trying to follow their lead. We're trying to figure out what they need. Are they lonely, sad, depressed, in pain? Are they tired? Are they bored? And what do they need? And how can we move them to a better state of wellness? So we use a lot of different methods. Improvisation. Familiar songs with words, they can be positive or negative. So when you're anxious and in fear, you don't want to be playing something that's going to trigger a negative memory. So I use a lot, what I was just doing there is just improvisation. And we have lots of different patterns and methods to do that. And I'm always watching your response, and I can change with it. We use different modes, the ancient modes of modal music. So we might start in something that's called Dorian, which is a very grounding, stabilizing sound. And as I'm watching you, I might move into something more meditative and introspective. It's called Aeolian. And then if it feels right, I might move to something more uplifting and happy, which can be Ionian or Mixolydian modes. So we use these modal music.
So fascinating.
Of course, if somebody asks for a song, I will play it. If I don't know it, I might play the first line and then go to something different, a little improv, and then bring you back to it. But we're also trained in the 12 different genres. I can offer you classical, hymns, Celtic, country western, Broadway songs. But really, in the hospital setting, when people are in a lot of pain and they're anxious, that's not really what they want to hear. So on that typical day, when I come in, I tend to go to the lobby first. I'm usually here Monday, Wednesday, Fridays, somewhere between 11 and 3. And the lobby's very busy around noon, 1 o'clock. And just to enter into that stressful environment and you just hear the harp, just for the 30 seconds that you're walking down the hall, people will go, oh, that's so nice, you know, just that little positive thought. And then I'm in surgical services waiting room, many of the waiting rooms, and that is actually the most difficult place to play because you're juggling so many emotions. I am constantly watching people. Because I don't want to upset them. They're fragile, you know.
Correct.
They're going to get a test. They're going in for surgery. They've been waiting for somebody for 6 hours, and they want to know how they're doing. So, very, very fragile playing. A lot of improv there.
Wow. So the benefits for patients, but it sounds like also visitors. And what about staff? I mean,
oh, the staff love it. They, you know, some days I'll come in and a nurse will go, "Oh, it's the harp lady today. Can you follow me from room to room?" Sometimes when they're doing a difficult procedure, they might ask me to come in. They have an IV that's hard to get in. And it relaxes them, it relaxes the patient, and the IV goes right in. No, but it really is wonderful. I'm asked to stay in the room sometimes if they come in for a procedure because it's relaxing for everybody.
Sure. Wow.
The surgeons will walk through just for 30 seconds, you know, and they'll say, "Oh, that's so beautiful." And it's just wonderful.
It does. It strikes you.
That little bit.
So the benefits, how do you summarize the benefits of all this great work?
Besides the simple sighs, the moans, just the ah, the facial muscles, you know, relax. There really are, and there's lots of research going on. I mean, we're definitely decreasing fear, anxiety, stress, tension. We're increasing oxygen levels because people are breathing deeper. They're relaxed. You watch the monitors, the oxygen levels go right up. Blood pressure can come down. We usually play 60 to 80 beats per minute to match the heartbeat. You know, there may be less need for pain medication. There's a lot of research going on about that. It just enhances the quality of life. And I put a lot of people to sleep.
That's fantastic. So I bet you have some, I know our time is flying. I mean, I could just spend so much time with you. So I bet you have some stories. Do you have a story
I
or
have
two?
3 quick stories.
Okay.
I keep a journal because every day it's just amazing, and I just want to write them down. So there was a 92-year-old lady. I'd seen her in many other settings, and I walked into her room, and she said, "Oh, I've been thinking about you." She said, "It was a really hard winter. And on the bad days, I would remember the harp. And I'd close my eyes, and I could hear the sound, and I could feel its peace." So then I'm playing for a woman. She can't get to sleep, and she's really tired. And I said, as I tell everybody, just let me play. You don't have to say a thing. I'll tiptoe out. So I started playing, and she reached for the Kleenexes. The tears started coming. And as I do with people, I'll say, just let me know if you want me to stop, but maybe you need to release something. And, you know, she did. She said, "Oh, I've been so tense all day, and this is the most beautiful thing that's happened to me today." So she settled down, everything relaxed, she fell asleep, I tiptoed out. A lot of people are on feeding tubes. So when I go in, eating is such a nurturing thing to do for yourself. So I'm playing this music for them. And, you know, they closed their eyes, and when I finished, they opened their eyes and they said, "I floated away. I wasn't even in the hospital anymore. I was in the forest. The sun was coming through the trees. The birds were singing. You fed my heart and spirit."
Oh, my Lord. How touching.
So,
that's heartwarming. Wow.
How can I not do this?
Exactly.
So it's the interconnectedness.
That's what inspires you?
It does.
Yeah.
You know, people are at such a vulnerable time in their life, and it's such a gift to be invited in, to be part of that and be there to support them. And my passion is playing the harp, so to be able to do that, it's been a dream come true.
And it's an incredible gift to our community.
The power of music.
Yeah.
The power of music.
So what feeds you? Does this feed you? I mean, you do this great work. Is there other things that you do?
I spend a lot of time in nature. I love the silence of nature, and so I'm outside a lot, and I do find that feeds me. Yes.
Wow.
Yes. So it is worldwide. I hope we'll be seeing more and more of it.
Yeah.
Different settings.
That's beautiful. Thank you so much for bringing your talent, your passion to our patients. It's when I hear it in the hospital, I just do the same thing. So we all gravitate to you. So thank you for that gift and for sharing that.
Thank you.
I wish we had more time. I'm Jill Bowen, CEO of Northwestern Medical Center. It's just wonderful to be your host for Healthbeat and share such beautiful stories as this. So if you haven't heard the harp, maybe Monday, Wednesday, and Friday, you should be there around noontime, at least in the lobby. It's beautiful, and we have this beautiful music. So thank you so much for joining us today.